Local leaders, stakeholders, and legislators are coming together to discuss the path forward for mental health and wellness in our communities.
We are holding a legislative briefing here at St. Clair County CMH to talk to our legislators about MDHHS's proposed competitive procurement process, which would eliminate the current PIHPs. They can't even bid on it the way the RFP has been structured. And so we are concerned that our legislators have not been made aware of this. And before it's too late, we want to educate them about the initiative and what we think the implications are for the state of Michigan and the people that we serve. So the people that are attending today, I think we have about 12 legislators. We have 2 state senators and then a lot of state reps. We also have CMH and or PIHP CEOs, about 7. Macomb County is represented, Oakland County, St. Clair, Genesee, Sand-Lac, and Lapeer County. We have that kind of representation. We also have other community stakeholders, key community stakeholders in our opinion, important people and people who care. This effort needs to be stopped because we have already seen how the private plans have operated in terms of not having sufficient providers or access for when the Medicaid private health plans, when they were managing the benefit for the mild to moderate, they did not have nearly enough capacity and people were just coming to us. Now that we're CCBHC, we can take the mild to moderate. We also take everybody, code-defined population, people with severe and persistent mental illness, substance use, intellectual and developmental disabilities. So we know that a lot of advocacy organizations are against this initiative.
Currently in the state of Michigan, our services are designed around the people we serve. In other words, the public system is, decisions are made, local insight is provided, and the privatization of those services would cause that local oversight and public transparency and accountability to be resolved. We can't do it alone. Macomb County Community Mental Health and all of our partners, both in that county and also surrounding counties, every person has unique needs, and in those unique needs, it's not just about their mental health, it's also about their physical well-being, it's about whether they have a safe place to live, it's whether they have food to eat, whether they can thrive in their community. So we're here to collaborate all together in order to address all of those needs.
NAMI, the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization. We started back in 1979. We currently have over 700 affiliates nationally, 15 here in the state of Michigan, that touches about 86% of the state's population. And we represent and advocate for anyone who's impacted by mental illness, whether it's a person who lives with a diagnosis, family member, caregivers, and literally the community at large, because directly or indirectly, everyone's impacted by mental illness.
Together, they're working to ensure a stronger and more supportive future where mental health and wellness remain a priority. With MCoast TV, I'm Melissa Painter.